So what I'm going to describe is more of an initiative than a program, and because it's more, it does have some more abstract stuff in it. So if you're not understanding some of what I'm saying, then raise your hand and ask me to clarify, because when you're part of something, sometimes you use words that are very meaningful to you and they're not meaningful to anyone else. So just please feel free to raise your hand and ask for clarification. And where I'm going to start actually with this is from Gloria's statement around disciplines working in isolation of each other, and how do you get doctors and OTs and nurses, nurse practitioners, and several doctors working together. So I'm going to start from there, and I'm going to tell you that the answer is that until we're working in partnership with the person receiving the care, that doesn't happen. No one goes into their discipline wanting to give siloed care and isolated care. Everyone goes into their discipline wanting to give really good quality care to the people that they serve. And the way that we pull everyone together, again, around improving care, always, 100% of the time. And Michelle and I just celebrated our 30th anniversary of going to occupational therapy school together. And reconnected kind of in two ways, because we were having our 30th reunion and our names came up together on Gloria's panel, so it was very coincidentally. But over 30 years, the only way to actually bring people together so that they're all on the same page, working toward the same goals, is around talking about partnering to provide the care for the patients or the people receiving the care that we receive. So that's my starting point. And where I'm going to go to then is that the BC Ministry of Health has created a goal for BC, and it's very exciting. It's not common for a Ministry of Health to have such an all-encompassing visionary goal. And so some of what we're seeing happening in the province of BC is directly related to the courage of the Ministry of Health to do this. And so the goal is providing a system of community-based healthcare and support services around attachment to a family doctor and an extended health team with links to local community services. And that's in their service plan. You can pick it up on the website. It's in public domain. And they're in the BC Ministry of Health Service Plan for their 2012-13 to 2014-15 goal. So their expectation of both family doctors in BC through their program, I'll talk a bit more about that in a second, and health authorities is that by 2014-15 we'll be well on the way to providing integrated care in communities. That means that our teams won't be isolated, GPs won't be isolated from our community health teams, that we will be actually and effectively working together in communities. And so just a little bit more background. Many of you will know this, but some people may not. Both family doctors and health authorities exist in formal health systems, but traditionally our formal health systems have been different. So physicians are part of Medicare, part of our universal Medicare program and insured service. Most family doctors work in private businesses, billing our medical services plan on a fee-for-service basis for the services that they provide. That's one system of care. It's through the primary care division of the Ministry of Health. Health authorities are under the Health Authorities branch of the Ministry of Health, and that's global funding that comes to health authorities. And so the whole system of care that we have between our family doctors and our health authority staff, both acute care and community-based care, is two separate systems of care. And that's true in BC. It's also true across the rest of the provinces.
Shannon, could you just say, what does the health authority fund? Which services?
Okay, health authorities in BC, which is different for anyone who's here not from BC, but the BC health authorities, the geographic ones, like Northern Health Authority and Vancouver Coastal, fund acute care. all kind of levels of acute care, so the really specialized tertiary levels plus your community-based acute hospital care.
So what does that mean, hospital?
Hospital care, yeah, hospital care. Also our community-based home health services, so that would be things like home care nursing, occupational therapy in the home, physio in the home, home support, the personal care services, adult day programs, assisted living and residential care, mental health and addiction services, so that would be both the hospital-based mental health, but also the community-based mental health teams. So there's some for children and youth, some for adults, and then some for older adults. Public health, Health Authority funds the public health, so that would be your school nurses and your nurses that provide immunization, the youth clinics, all of those prevention and public health services are through the public health lens, as well as environmental health. So that's environmental health is things like outbreak, where if there's an outbreak, say people go to a restaurant and get E. coli, right? Or get it off of the shelves at the Safeway superstore. So it's outbreak, it's things like, again, bigger campaign immunization, it's inspection of our restaurants and our school, our pools and our residential cares and our child daycares, etc. And I'm probably missing a few things, but you can see that it's very broad and global in what it encompasses, except for primary care, the family physicians.
And pharmacy.
And pharmacare, correct. Yeah. So pharmacare is another whole system. Yeah. Okay. So when the BC government made this broad goal, then what they're asking two very, very different and extremely separated formal systems of care to come together to create integrated primary care networks. And that's been going on since about 2006, 2007 in some form or other. What the physicians have done is really actually very amazing, and I think there are some jurisdictions in the rest of the world who have similar things that have happened, but not so quickly. So the family physicians, through their General Services Practice Committee, which includes both BCMA, their BC Medical Association, and the Ministry of Health, they have actually come up with a plan to have divisions of family practice. And divisions of family practice are non-profit organizations, local community GPs coming together in a non-profit organization where they actually can do some planning and work together. And if you think about a family physician working in a private practice in his office before, how is he going to connect with other GPs? There's no way. He's working in his own business and he's seeing his own clients or patients, and he had no way to connect either with the health authority necessarily or with other physicians. So you can imagine what this does when they come together in divisions of family practice, and all of a sudden they can work together and they can work with the health authorities. And so that all of a sudden has given health authorities a way to work in a more formal way and in a more logical way, collaborative way, but logical way as well. So collaborative, yes, but logical way with the doctors who are providing service to the same people that we're serving in the health authority.
Who pays them for their time with health authority or with a meeting?
The divisions of family practice are funded through the medical services, so through the primary care branch of the ministry, to have the administrative piece that they need, right? And so they have now an administrative an administrative basically based in order to allow them to exist and to work with health authorities and to work with communities. Okay, so now what happens is each health authority or each community within a health authority then has the health authority leadership staff meeting with division of family practice leadership staff to say, how are we going to work together to improve the health of our community? And so it's just starting. And I don't want to say we're all the way there because divisions only came about in 2009, I believe. So some of them were way far ahead already because in a small community like some of the ones that Anne was in, the physicians already were talking all the time and we're talking to health authority staff too. They're small, they all work together. But you can imagine, we're sitting in Vancouver. Vancouver has over 1,000, I think, right? Family physicians practicing.
Anyway,
Yeah. So across Vancouver, there's over 1,000 family doctors working. You know, there was no way for them to organize and be able to move forward really fast, and they certainly weren't organized like, say, Prince George's before the Division of Family Practice came into being. So it'll take a little longer in a place like Vancouver, of course. But that's the excitement. So part of the BC Ministry of Health's goal is then to engage people in the community, and that's the exciting part for you, and I think that's the main part that I'd like to say today. Each of you, if you're in BC, are part of a community that's working towards this goal, and so that's my time, huh? Okay, 1 minute. So each of you are part of a community, and that community has ways to engage with the family doctors and with the community. And our goal then is to actually create these teams that will be supporting people who need our services in a different way, where the family doctors and our community health staff, both the mental health staff and the community staff, are working together. And so I do have a piece of paper that gives a bit more detail about one of our communities, but I'll pass it over to the folks that are giving you more concrete programs. And if you have questions, we can talk about it later.
Now we'll turn it